Hello and welcome to Missouri Legislative Update. This month we bring you our program from the third floor rotunda located in the Missouri State Capitol. In today's show, we take a look at the House and Senate bills that made it through the legislative gauntlet and received the governor's stamp of approval. I'm Jonathan Lorenz reporting for the Missouri House of Representatives.
And reporting for the Missouri Senate, I'm Jennifer Yapel. Of the 82 measures delivered to the governor during the 2013 legislative session, the governor signed 28 of those Senate measures before the constitutional deadline to take action on legislation sent to the executive branch for approval. The governor has 15 days to act on a bill if it is delivered to him during the legislative session, and 45 days if the legislature has adjourned. This 45-day time period ended on July 14th. Meaning the governor either had to sign or veto measures that were approved by the General Assembly and sent to his desk. Bills not receiving the governor's executive approval will become law on their effective dates. One of the most high-profile bills of the 2013 legislative session was Senate Bill 1, sponsored by Senator Scott T. Roop of Wentzville. The legislation addresses Missouri's insolvent second injury fund by establishing priority for paying fund liabilities and instituting a funding mechanism to bolster the second injury fund when usual collections are inadequate. Senate Bill 23, sponsored by Senator Mike Parson of Bolivar, eliminates both state and local use taxes on motor vehicles, trailers, boats, and outboard motors, and instead collects a sales tax for the titling of these items. Senate Bill 23 also creates the Rebuild Damaged Infrastructure Program to provide funding for the reconstruction, replacement, renovation, or repair to structures damaged by a presidentially declared natural disaster in the state. One of the largest education bills signed by the governor this year originated in the Senate. Senator Jamila Nasheed of St. Louis sponsored Senate Bill 125. The legislation requires new administrative rules to include certain standards to determine the accreditation status of a school district, allows tenured teachers in the St. Louis City School District to be removed for inefficiency and incompetency in the classroom, and removes the 2-year waiting period that exists between the classification of a school district as unaccredited and the lapse of the district's corporate organization. Legislation sponsored by Senator Shalon Kiki Curls of Kansas City contains several provisions relating to health care insurance. Senate Bill 262 allows the use of telemedicine to provide certain health care services to Missourians and requires individuals to establish a doctor-patient relationship before they receive a prescription or treatment through the Internet. The bill also gives licensed health insurance navigators the authority to provide information and service in connection with the eligibility, enrollment, and program specifications of any health benefit exchange operating in Missouri. The Senate also focused its time during the 2013 legislative session on preventing public assistance fraud and abuse. Senate Bill 251, sponsored by Senator Will Krause of Lee Summit and co-sponsored by Senator Maria Chappelle Nadal of University City, prohibits Missourians who receive TANF benefits from using their EBT cards in liquor stores, casinos, or other similar places. Finally, the legislature passed and delivered to the governor numerous public safety measures. Senate Bill 75, sponsored by Senator Dan Brown of Rolla, allows schools to teach a gun accident prevention program and prepare teachers for potentially dangerous or armed intruders. Also sponsored by Senator Brown, Senate Bill 230 establishes Chloe's Law, which requires every baby born in Missouri to be screened for critical congenital heart disease starting January 1st. And Senate Bill 256, sponsored by Senator Ryan Silvey of Kansas City, extends the time period of the state's Safe Place for Newborns Act, which allows parents to leave their newborn with a member of the medical field or an emergency responder. In total, the governor signed 62 Senate bills, let one lapse into law, and lent his veto pen to 19 measures this year. You can see a complete list of Senate bills passed by the upper chamber and delivered to the governor at the link below.
Lawmakers truly agreed and finally passed 80 House bills during the 2013 legislative session. Of those 80 legislative proposals, more than 60 of those bills received the governor's signature. One of those signed bills aims to protect the state's future. Governor Jay Nixon put his stamp of approval on House Bill 256. The The legislation aims to protect the state's schools by renewing an exemption in the state's Sunshine Law, keeping the security plans and evacuation policies of our state schools exempt from public record.
We'll make sure that anything that we have as a public entity is still applicable to the Sunshine Law. However, in this one case, we do not want anyone who wants to harm our children or harm anyone in the government to know the security codes, to know how to get into buildings, to know how to make use of a space that is supposed to be used for education.
Lawmakers attached an emergency clause to the proposal, meaning it became law following the governor's signature. The governor signed another House bill aiming to strengthen the state's child protection laws. House Bill 505 requires current mandated reporters to call the state child abuse hotline whenever they witness child abuse or neglect. The newly signed bill also contains language eliminating a current option for mandated reporters, which allows them to report any suspected cases to their superiors. Lawmakers included an emergency clause in the legislation, which means it became law following the governor's signature. House Bill 400 ran the legislative gauntlet and became law despite not receiving the governor's stamp of approval. Governor Nixon did not take any action on the women's health bill and allowed it to become law without his signature. House Bill 400 aims to protect women who take abortion-inducing drugs. The legislation states the administration of any abortion-inducing drug must take place in the physical presence of the doctor who prescribed the drug. Supporters hope the bill will crack down on webcam abortions, a procedure that has produced dangerous results.
We've had 15 deaths and over thousands of problems with women being hospitalized, IV drugs, emergency room blood transfusions. So regardless of what you're hearing, this is about women's health. This is looking out for the women in this state, and I urge the body to vote for it. Thank you.
For a list of all the House bills signed into law, you can visit the House's website at house.mo.gov.
During the interim, the time between legislative sessions, lawmakers continue to hold committee meetings on various issues. Senate Communications correspondent Brad Bayshore highlights the work of several Senate interim committees.
We're going to have an opportunity for testimony.
The Senate Interim Committee on Medicaid Transformation and Reform was created during last session with the goal of reforming Medicaid by improving system efficiency, financial stability, and delivery of care. The panel recently held a series of public meetings at the state capitol. Senator Paul LaVota of Independence discussed the issue of how not expanding Medicaid could be costly for other areas of government.
One of the issues that we're going to have when it comes to transforming Medicaid is cost. But if we look at simply the cost of Medicaid, we're going to be losing the idea that there's more cost on our prisons, there's more cost on our criminal justice. And that's a pretty big thing for all of us to look at when we're looking through how we can expand or not expand.
Committee member and practicing physician Senator Rob Schaaf of St. Joseph discussed issues with the state's disability program.
And it's broken, and we need to fix it. Not, whether or not we expand Medicaid, we need to fix that problem. And so I would like to know more about the roadblocks. Why exactly is it that it's not easy, that it takes 2 years? And why is it that people feel that they're trapped in it?
The interim committee will hold more meetings in the coming weeks and is required to share its findings and recommendations to the General Assembly by December 15, 2013. The Missouri Lead Industry Employment, Economic Development, and Environmental Remediation Task Force also recently held its first meeting of the interim in early July. The task force includes 3 members of the Senate, 3 members of the House, and 2 appointed industry representatives. The panel is responsible for making recommendations on prompt environmental settlements and creating ways to promote and develop a clean lead industry in the state. Committee Chairman Senator Gary Romine of Farmington highlights the history of lead production in Missouri.
Great manufacturing opportunity, a mineral resource that's very unique to Missouri, and it's very primary to Missouri, and that we will be the only primary producing industry in this country if we keep this operation solvent and going forward. And that's our main goal, is to make sure we create an environment that the lead industry can go forward.
Task force member Senator Ryan McKenna of Crystal City discusses the need to keep a lead facility in his district open for business.
We knew if they closed what that would do to the city of Herculaneum, the school district, Jefferson County, and the state as a whole. And since that time, I've been in lots of discussions about Doe Run and how do we get them to stay, how do we keep the only lead producer in the Western Hemisphere open. This is an economic development issue. This is a military issue in my mind.
The panel must submit its report to the General Assembly and is set to expire February 1, 2014. Reporting for the Missouri Senate, I'm Brad Bayshore.
Currently, there are 162 members in the Missouri House of Representatives. 58 of those make up the freshman class of the 97th General Assembly. In this next story, we sit down with two of those first-timers to get their take on being in the Missouri House.
25 states are...
As the 2013 legislative session came to a close, more than 50 first-time lawmakers wrapped up their first legislative session as members of the Missouri House. The freshman class of the 97th General Assembly was made up of 37 Republicans and 21 Democrats. The freshman class was made up of individuals from all walks of life, small business owners, farmers, and more. For one freshman Democrat, it was an up-and-down experience.
Having worked in the legislative realm for a long time, I thought I knew a lot about what was going to go on, and certainly I did, but there have been some things that have just been new and interesting, and I'm kind of learned my way and learned some lessons and had some successes and had some challenges, but I think it's been, I've really enjoyed it. The best part has certainly been doing the constituent work.
Several of the new members might look like they are right out of college, but one freshman lawmaker claims age was not a factor during his first session in the Missouri House.
When you come up here, if you work hard and just stay abreast of everything that's going on and can have intelligent conversations with people and point out things in legislation and make intelligible arguments about it, I think people set age aside.
Looking forward, both freshmen have big items on their legislative agenda they hope to accomplish.
Changing the budget process a little bit, making it a little bit more transparent between the executive branch and the legislative branch, as far as dealing with the way the executive branch proposes their budget, and then how the House of Representatives and the Senate take that up and pass it.
All the things I want to do in terms of getting more money for kids who are victims of abuse and neglect, getting more money for early childhood education, we can't do those things without a little bit more revenue to the state. I think there are responsible ways to do that, and I look forward to working on that over the next 8 years.
The freshman class of the 97th General Assembly and the rest of their House colleagues will return to the state capitol on September 11th for the annual veto session.
When we come back, Bob Priddy of the Missourinet speaks with State Senator Gary Romine of Farmington about his role as chairman of the Senate Interim Committee on Medicaid Transformation and Reform and what the panel's doing to address Medicaid reform in the Show Me State. Stay tuned.
Welcome to Capitol Dialogue. I'm Bob Priddy with the Missourinet of the Missouri Channel. We're glad to have you with us. Our guest today is Senator Gary Romine, who is from St. Genevieve, a rookie member of the state Senate who's just survived his first session in the state Senate. Now, you have been on the chief of staff for a couple of senators in the past, but how is it being in the arena yourself? How was it?
It was a very good year. I enjoyed my time. I really felt like we had a good leadership in the Senate this year, and quite a few pieces of legislation got passed. I felt like it was a very successful year.
Tell me about being a senator. I mean, this is you've seen it, but when you actually are the guy who is in the spotlight, who's getting the pressure from all of these different places, tell me what the experience is like to actually be a Missouri senator.
It's very simple. If you're just really concerned about the needs of the constituents, you take time to listen to what their concerns are and what the problems are, try to build something that satisfies or fix those issues, and it's a rather simple process if you just keep it simple. You can complicate it if you want to, but it's really about meeting needs and taking care of needs.
Now, this first committee that we're going to be talking about is a committee on, let me see if I get the name of it right, it's a committee on Medicaid Transformation and Reform.
Correct.
Tell me what you think that involves.
Well, we spend 28% of our budget on health care services. That's the largest single expenditure we have in the state. Education's at 27.3, I think it is. Those are approximate numbers. To me, it's very critical that we get it right. And over the years, I've heard a lot of concerns and complaints about the waste and the fraud in the Medicaid system, and the fact that right now the Affordable Health Care Act's requiring us to to go to 138% poverty level to be able to receive the funding from the federal government. So we have to balance somewhere between what is rhetorical comments and what's real in fact. And so to me, the most important thing that we can do with this reform committee is to find out what our program is today, what can we do to improve upon it and fix some of the things that's been commented over many years now. 5 years ago they did a study, some good results come out of it, but we need to do more. We need to get this right, and we're under the gun. We need to get it done now, because come January, as the Affordable Health Care Act kicks in, we stand to lose some funds.
138% of poverty. We talk about percentages here. This is kind of inside baseball talk when we start talking about that. In terms of dollars and cents, because many of the folks that are watching this program probably don't know what the poverty line is in terms of dollars and cents. It's pretty low, isn't it?
It's a low number, and I apologize because I don't have that number here, but I know that when we spend 28% of our budget's $24 million. We're spending just under $8 million for health care services. So that's a sizable number in itself, and that's the number I've been working off of. But as I look at these other numbers, you know, for pregnant women, we're at 185% poverty level. At some of the other programs, we're at 19% poverty level. So the percentage of poverty levels all across the board on the various programs to take care of the children, the pregnant women, and the elderly, the disabled, to go to 138%, we got to find out what that really means as well. Is that a blended rate? Some stay low, some's going to go higher. We've got to wade through all that before we really find out what that number really means.
Should there be different levels for different conditions?
I believe so. That makes sense, that there's reasons for serving and taking care of those with those particular needs. And some of it's based more on physical conditions, some of it's based on economic conditions. So I think there needs to be a variable there.
Now, I'm sure some people are thinking the reform is going to involve eliminating some people from Medicaid or other health care services. Is the goal anywhere to eliminate some people that you think don't need this service?
The only one that would be eliminated would be those that are trying to beat the system or cheat the system. We got to find out. We need to incentivize people to want to be productive citizens. And so there will be an effort to encourage those that can be productive citizens to society to do so, instead of to be dependent upon the state and the federal government.
Do you have any fear that if we set up a Medicaid program, that our Medicaid program will be far more attractive than that in other states, and we might have people who go shopping for Medicaid who move into Missouri to take advantage of our program?
That will be a variable that we will have to consider, but our primary responsibility is to make sure we take care of those in need. If we take care of those that are in need, then the program will be efficient. And there's just so many ways that people can game the system. Just for example, the hospice care. It would be nice if a family member could do the bathing and some of the things that are required for that hospice. But then again, you're going to have folks that's going to take advantage of that. They live there already. They're going to collect a check for something that they're already doing. How do you balance those and create an environment where those that really meet the needs and are covering the needs can do that without the program being so opened up that it's taken advantage of? That's just a small example of areas that we've got to create a balance.
But you can't get yourself all wrapped around an axle trying to be so definitive with so many regulations that it's just almost impossible for people to comply with it.
It is. I run a business. We've got several variables to our business in sales, collections, service. We've got several spokes to that wheel. And to me, that's how we have to approach this. Is we know that we can't get ourselves tied into a knot, but we've got to have each spoke lined up so that it's coming to the hub and creating the outcome and success that we want.
Are we going to see Medicaid expansion in 2014?
I will say there's going to be some variance to that, but like I started out saying a while ago, there's already variations up to 300% of poverty level for some of these programs. So we've got to find out what the blend is that may get us there. The one things that we have to avoid and we've got to get away from is the cliff. We can't expand to 138% and have another cliff. We've got to take from where we're at now to that 138 and create a slope or a graduation of numbers so that it makes more sense and more effective, so that we don't have people get to a certain point and say, I'm going to have to quit work because I got a $20 a week raise and I'll lose my health services. That's wrong in where we're at right now.
thing is, you're dealing with human beings here. You're not dealing with just numbers. You're not dealing with just the abstraction of a program. You're talking about real human beings. And people like you, I guess, have to kind of keep that in mind because those are your constituents.
Absolutely, and we will have our hearing tomorrow, Tuesday, concerning the public coming in and sharing the stories. We've already heard most of the stories as we've gone through the district, but looking forward to seeing on record some of the various issues that are out there. I think that's the only way we can really respond is if we understand what the needs are. But beyond that, I think we've heard the stories enough over the last several years that my committee or our committee that we're going to be working on, my philosophy is we need to work on the nuts and bolts. We know there's a problem out there. We know that the Affordable Health Care Act is being put upon us. So therefore, we need to roll up our sleeves and start working on the mechanics and the nuts and bolts of making this program work.
After the break, Bob Priddy sits down with one of the Senate's top Democrats to get the other side of the story. That's after the break on Missouri Legislative Update.
Traditional light bulbs actually generate 9 times more heat than light. Switch to energy-saving bulbs. Saving energy saves you money.
We're in Senate Committee Room number 1 today as we talk to Senator Joseph Keaveny, who's from St. Louis. Committee Room number 1 is one of the 2 major committee rooms on the first floor of the Capitol, and during a legislative session, these rooms are packed and very, very busy. In the interim, there are hearings that are held in these rooms from time to time, and as soon as we get done recording this program with Senator Keaveny, he's going to go next door into Senate Committee Room number 2 and start work on a special interim committee that takes a look at, and I have to look at my notes all the time because it's a long committee, Medicaid Transformation and Reform. So he's part of that special interim committee, and this group is going to have recommendations for the session in 2014. First things first, Missouri did not agree to Medicaid expansion in the 2013 legislative session. Is this because people need to investigate it like this committee is going to do?
Well, I think that's one of the reasons. I think, you know, the whole expansion is going to take some time for people to be convinced that we can do it and that it's the prudent thing to do. So by having this hearing that we're about to start, we're going to take a good look and see the cost, both the pros and the cons of expanding and reforming the current Medicaid system in Missouri.
This is going to be a long process, though. You're not just going to have one hearing and then make a decision. There's a lot of complicated things in this whole package.
That's exactly right. And today, today's meeting's more just for the members to get a good understanding of how the current Medicaid system works in Missouri. Tomorrow we'll come back and we'll take public testimony. But today we bring in the experts to explain how things work, what are the shortcomings, what are the good points, and see what we have to do to adjust it.
From the Democratic side of the aisle, which you represent, should the legislature have done something in 2013?
I believe so. I believe so. We left a lot of money, our own money, at the federal level. You know, and the numbers range between $400 and $700 million that really could have provided good service to the people of the state of Missouri.
Now, some of the folks on the other side of the aisle say that this would be a case of leaping before we looked.
And you know what? There's a case to be made for that. Even with the Affordable Care Act now, it seems like weekly we get an update of maybe one thing's not on track or maybe we're postponing one thing for next year. So there's a lot to be said for taking a good look at before we leap.
So what do you think are the kind of reforms that might need to be made?
Well, you know, I got to tell you, and I also serve on the Mo Health Net Oversight Committee. Our Medicaid system operates very good in Missouri. We don't cover enough people, I don't think. Basically, the only people that are on Medicaid in Missouri are children, pregnant women, and disabled people. So there's a significant portion of the population that doesn't have health insurance. And I think by taking a good look at how things work and what we need to adjust, we can get more of those people covered.
What populations are left out that you'd like to bring into the circle?
Well, it seems like, you know, the working poor. You know, a guy and a woman maybe each have 2 jobs trying to raise a small family. They can't afford their own health insurance, and they don't qualify for Medicaid because they make too much money. So they end up not being served at all.
Do you have any fears that there will be employers rather, who decide they're going to pay a fine instead of providing insurance to their employees, and how do you counteract that?
Well, you know, that still needs to be, that's one of the areas that we need to take a good look at. I would sincerely hope that employers wouldn't do that. You know, this is about quality of life. It's about going to the doctor regularly instead of showing up at the emergency room. I think if an employer really cares about his employee, he'll provide that service. You know, if it's just dollars and cents to the employer, then, you know, maybe that employee doesn't want to work there after all.
But can you see that there are some small businesses that might decide they just can't afford to do this?
Well, again, and that's what we have to learn. I don't know what the cutoffs are. I've heard those same stories that you have, that some small businesses won't be able to afford it, and maybe we need to provide for them just to keep them competitive.
When I was talking to Senator Romine in the first segment that we did, we talked about the poverty level, and this whole thing hinges on 138% of poverty. Can you, off the top of your head, tell me what the poverty level is? What is poverty? It's not very much money.
It's not, for a single guy, it's about $15,000. For a family of four, it's about 32, I think it is. Well, that's the 138%. The poverty level will be a little bit below that, but most of these will apply to people within that income range.
Now, one thing that goes along with the Affordable Care Act, Medicaid reform, and all of this is that we're going to have a health insurance exchange. Yeah. It's going to be run by the federal government because Missouri didn't want to do it this time. How is that going to plug into all of this?
Well, again, and now we're talking about people having access to health insurance through the exchange, and the federal subsidies will kick in. They'll step in as people buy their insurance on the exchange. So the less you make, the more credit that you'll get from the federal government to help you afford your premiums. I think it was a big mistake that Missouri didn't form their own health insurance exchange. I think it's a mistake that we're relying on the federal government to step in and do it. It's an important service that we could have provided to our citizens and, you know, make them an educated consumer.
Now, it sounds to me as if you are not especially totally embracing this whole thing yet.
Well, you know, I'm not, because I'm not sure the nation as a whole is ready for this. I think we need to provide for our constituents. I think I agree with the administration on the end game. It's the steps to get there. And I think, you know, we need to be prudent, and we need to make sure we do it right.
Medicaid reform and expansion is a phrase that comes out. Do you anticipate Missouri is going to expand Medicaid?
I would anticipate that we expand Medicaid. And, you know, we throw in the reform part. As I said before, our Medicaid system's pretty well run. I'm not sure what kind of reform we're going to talk about here. So I think we will expand it.
If you were a betting man in 2014, will the legislature approve Medicaid expansion?
Yes. Yes, I am.
In an election year? In
an election year, I think we'll do it. The numbers are just so compelling. And the more we have these kind of meetings and these kind of committee hearings, the more educated people are, the taboo of Medicaid expansion will start to wither away. And people will make an educated decision, and I think we'll pursue it.
And that's our show for this month. If you have any questions regarding anything going on in the Missouri House, you can visit our website at house.mo.gov. I'm Jonathan Lorenz reporting for the Missouri House of Representatives.
And if you have any questions about the legislation or the committees that appeared in this program, visit senate.mo.gov. You'll find the contact information for the 34 members of the Missouri Senate, as well as the Senate's newsroom website. I'm Jennifer Yapel reporting for the Missouri Senate. Thanks again for watching, and we'll see you next time on Missouri Legislative Update.